Hello, my name is Andrew Kraft. I'm a recent graduate of SGU School of Medicine, and I'm currently an MPH student at SGU. And this talk is going to be about Ebola virus response plan. So the Ebola virus, it is a single-stranded RNA virus, a filial virus. There are 5 species of Ebola. Human to animal exposure of the virus can occur via bushmeat or contact with non-human primates. And per the World Health Organization, there were 28,000 cases with 11,300 total deaths in Africa during the last outbreak. The mortality rate, roughly around 40% for this species of Ebola, which was the Bundabogo, and this was the one that was in Africa. And another species called Zari had a mortality rate of 80% that has been shown in the past. Currently, unfortunately, there are no vaccines nor treatments for Ebola. So the incubation period for Ebola is roughly 3 to 21 days. Cytokines are released once the virus is in the patient's bloodstream. Disseminated intravascular coagulation can occur, and multiple organ system failures can occur as well. Bodily fluids of the patient are the most common way to transmit the virus to another person, and this includes blood, vomit, and semen. Breast milk has not been seen to transmit to the child. For this case, I am the district medical officer, and my role in the case will be to be the district medical officer for Ebola virus in the community in the Congo. An issue initially is getting enough isolation rooms for the patients who have the virus, having a meeting with medical professionals in the area to determine what resources they need at this time. And also have a phone number available for the clinics if they have a request that needs immediate attention. And then also a daily call with each clinic and hospital to document all cases. Protocols for Ebola, the THINK protocol can be used, and initially it is initiate care, and that is asking all relevant symptoms and to see if the patient has some of those symptoms. If the patient possibly has Ebola, it is important to test the patient and then see if that is true. And if it comes back positive, then isolate the patient immediately and also inform all health agencies of this new patient. Common Ebola symptoms: fever, headache, nausea, vomiting, and diarrhea. Abdominal pain and unexplained bleeding can occur, loss of appetite, and muscle pain as well. Uncommon symptoms for Ebola: chest pain, shortness of breath, sore throat, and hiccups. For physical exam, fever greater than 37.5 Celsius, a maculopapular rash, hepatomegaly, lymphadenopathy, and then possibly neurological deficits as well. For diagnostic testing, testing needs to be available at all hospitals and clinics so medical professionals can ensure which patients have the virus. The test of choice at this point is Ebola RT polymerase chain reaction for all suspected cases of Ebola. If the medical professional needs to confirm a case, they can use the ELISA. Other testing that can be done would be a complete blood count, bleeding profile with PT, PTT, and bleeding time, arterial blood gas, looking at the difference between alkalosis and acidotic patients, liver function tests for AST, ALT, ALP, and GGT. Also looking at renal function, you can look at creatinine and BUN, and then always monitor other vitals. The treatment for Ebola, unfortunately, like I said before, there is no medication that actually goes at the virus, so all care is going to be symptomatic or just standard care. There won't be any actual treatment for the virus. So for fever, pain, and headache, you can use paracetamol or something like acetaminophen. You can use fluids for diarrhea, and you can use metoclopramide for vomiting. For the healthcare workers, it is important to ensure that all healthcare workers approach each patient during an outbreak as a concern that they might have Ebola. For patients that have already been confirmed cases of Ebola, the healthcare worker needs to be covered from head to toe in protective gear, including eyes, feet, hands, everything. That is because no exposure can be permitted. Thousands of healthcare workers have died in the past managing these patients, and the bodily fluids are very contagious and can transmit very quickly. So it is vital that all healthcare workers managing these patients are covered from head to toe, and that needs to be enforced because that will be problematic for the healthcare worker if they are not covered. Unfortunately, some of these patients will pass away, and so for burial teams, it's needed to have an expert in the burial to ensure that exposure to the body is limited. Some of these communities in Africa, they will have a widespread funeral where there's a lot of people around close to the body, and this cannot be permitted during an outbreak. A patient that had Ebola, because if you have a funeral of 900 people, you've just risked 900 people getting exposed to these fluids and then possibly getting Ebola, and that can spread very quickly through a whole population. So the local community officials need to explain that when there is an outbreak, that is important that the community is not very close or hands-on with the patient that has passed away. For the interprofessional meetings, the current issues need to have multiple meetings with the entire group from state, local, federal partners, and the WHO to ensure all parties are all on the same page with how to proceed with the crisis and also update on the number of cases. The initial concern would be having enough healthcare providers to take care of the patients on the ground. Also have local officials who are trusted in the community explain the risks of Ebola due to the population fearing outside organizations. In the past, people from the WHO and other organizations have come in and tried to explain what is going on, and the population was very fearful and they did not listen, and that is something that cannot happen in the future. So it is important that someone from the local community that is a physician or of high authority with the population explain the risks of Ebola and what is going on, to have a clear message and show that this is very important to them and they need to understand what Ebola is and the risks involved. More current issues, having enough fluids and medications for the patients at all times, requesting more isolation tents for patients if that is needed, and then also monitor the population that still has enough food and water because they've had issues with malnutrition in the past, that the population cannot get enough access, that they don't even have Ebola, but there's just limited transport during these situations. So there needs to be food and water flown in if that is needed to make sure that these people do not have malnutrition. Future issues, to educate the community on the risks of bushmeat and also exposure to other primates. Some people in the community go out into the woods and look for this type of meat or around those primates, and they need to understand that that is a huge risk and that there needs to be more education that is not good for their well-being or the community's well-being, because there is a big risk for Ebola being around those animals. Once the Ebola crisis has passed, develop a plan to maintain healthcare providers in the country. Too many are leaving to go to other areas of the world, and this is important because not only for Ebola, but just primary care in general, there are not enough physicians in these countries, and that is a huge risk to the population, not only in an outbreak, but just on a daily basis, not seeing enough healthcare providers in the community. More future issues, there is a low quality of roads in the area, which makes it difficult to access many areas. So investment is needed to ensure that there's better access to different parts of the community, and also invest in more clinics where there is not an outbreak, just to have better infrastructure in place when Ebola comes back to the community. Because if you already have isolation rooms in these clinics, you don't have to put up all these tents and things like that. You already have infrastructure in place for these for these patients. And also very important is to develop a vaccine for Ebola so that the populations don't have to go through this if there's already a vaccine. So that would be important for the future to have a vaccine. Other future issues, increase the amount of full-time staff of the World Health Organization workers in the affected countries in Africa. This will improve infrastructure so they can be in meetings for infrastructure planning, and they also can be monitoring the situation to see if there's another outbreak of Ebola in the future, just to have more boots on the ground and more eyes monitoring the situation at all times. And also invent some new ways to improve literacy for the country because many school closings occurred during the crisis, and the literacy rate is already pretty low for the country. So it's important to have maybe better access to books that kids can bring home, or some other technologies so they can ensure that they are still keeping up with their studies, because they need to make sure that they're continuing forward with their education. And these are my references, and thank you for your time.